Roxanne asked me to talk about the importance of primary care. I guess I'm of a vintage where, like some of you anyway, where you remember Dr. Kildare and Dr. Welby and, you know, the family doc. I grew up in Scobie, and there was 2 general practitioners in town, and if you needed some help and some health care, you just went to the local doc. Well, healthcare is really complicated now. It was a lot simpler back in the 50s. In the 20-teens, some people describe modern healthcare as the most complex undertaking that humankind has ever done. I think that may be true. Whether or not it's true, it's pretty clear that one doctor or one person that you go to for your health care is not going to be enough. And unfortunately, in our current system, we've taken a leap beyond saying, well, if one person is not enough, then a whole lot of people must be a lot better, which is not the case. So what is primary care? It's good to agree about what we're talking about. This is what the Institute of Medicine, it's a big, a lot of famous people sit around talking, come out with a publication, provision of integrated, accessible health care by clinicians who are accountable for the large majority of personal health care needs, developing a sustained partnership and practicing in the context of family and community. What you don't see here is a hospital-based doctor or an individual. It's over a long arc of time and a broad perspective of care. It's not defined by the disease you have or where you're getting your care. It should be, it's person and patient defined, not disease defined. So these are the features of primary care that we try to reinforce and cultivate in our learners, in our residents, our medical students, and in our staff. One is first contact for each new need. You shouldn't have to think about where you go for your care. It's like, this is my medical home. I go to this place or to these people whenever I have a question. And if they can't answer it, they have the humility to point me somewhere that can. But that's my first contact. That it's long-term and it's person-focused. Again, I've had family and friends and neighbors who felt that, if you had a headache, you needed to see a neurosurgeon. Well, that's not the best place to go for a headache. God forbid you should have a headache that requires a neurosurgeon. Occasionally it happens, but it is not usually the case. And comprehensive care for most needs. Most of us, we all are going to have a serious problem sometime, but 95% of our needs really should be able to be handled by a generalist. And then the other thing is that the people that take care of you in primary care should hold accountability and responsibility for who else you see. As a primary care doc, I define my quality of care by who I work with. So my job is to manipulate the healthcare system for the patient and their family's benefit, but also to protect you from things, from the very real peril that is in healthcare. When you go around and have focus groups, survey, do ethnography, talk to people in the community, this is mostly what people want about their care. I mean, some people would say, don't hurt me, help me, treat me as a human being, treat me as an individual, understand what gives meaning and purpose to my life. I mean, more concretely, they want the care that works where and when they want it. They don't want to, if you're in Malta and you have to drive to Billings for care, that's not good primary care. And that's one of the things in our residency we're trying to make a contribution to putting primary care physicians in the region where there simply aren't enough physicians. People want information. The idea of doctors being in control and telling you what to do and following the doctor's orders, well, you need to you're paying for advice. You probably ought to listen to the advice anyway, but it's not so much orders but advice. And people want the reasons and they want to have an understanding of what's going on. And then they want to have a relationship. a relationship maybe with a doctor, but maybe with a physician's assistant or a nurse practitioner. Or fact is, in most primary care practices, your first contact is with a nursing staff of some sort, either a registered nurse or a licensed practical nurse or a medical assistant. So it's sort of, you know, it's a medical home and it's a family, and you know, you should be able to, if you can contact someone in that group, you can get to the answer you need. You don't always usually need to talk to a doctor. So the ideal care model is to transform that relationship from the dyad, the one doctor, one patient model, to a team model, and where you incorporate and you have the relationships that are long-term and continuous and healing and comprehensive. So that's what we're striving for in primary care. Our residency, the vision for our residency is to transform the care model around the so-called triple aim. Better care for individuals, not only the correct care or the indicated care, but so people feel cared for. So whether or not your provider can fix your problem, you should at least feel listened to and cared for and appreciated in some way. Better health for the population. You know, Billings Clinic is we take care of everybody without regard to their ability to pay. There's about 600,000 people in our service area, and they all haven't come to us for care. But we still need to take responsibility for the health of the population. That's where, you know, exercise and diet, and there's a program in the Billings schools to get kids out, you know, out from behind their video screens, out exercising, and kind of keep them away from pizza and sugary drinks. That makes a big deal in health. Does that have anything to do with health care? Well, not in the traditional sense, but it has a lot to do with health. And so both the physicians we're training and healthcare organizations are starting to take accountability for that. And then better value. Training in San Francisco and Seattle, I realized that a lot of the care that I was giving as a physician was care that nobody in my family could afford. Well, when a doctor's family can't afford the care that he's involved in providing, we got a problem here. You can have safe and effective care, but if regular people can't afford it, it doesn't count. So we need to bend that cost curve. Turns out that primary care, healthcare systems that are based on a primary care model are much more efficient and high value. It's less spending, better outcomes than care that's based on subspecialty care. Plus, we want to have, you know, frankly, the business model for primary care is not conducive. It's not drawing young docs into the field in the numbers that we need. So we need to return joy to primary care practice. So the staff that are caring for you look forward to coming to work and are having some fun. I mean, a lot better to walk into your provider's office and see people that are nice to each other and kind of enjoy what they're doing, rather than every day being another exercise in survival, which sometimes it does become. So we see our residents as messengers we send into the future and into the region to continue transforming the healthcare model in this triple aim plus joy vision. Our mission is to bring general internists to the region. You know, most internal medicine residency programs lead to produce doctors that become subspecialists. We need cardiologists and gastroenterologists and rheumatologists. Absolutely, we need them. But the real gap in American healthcare is a maldistribution away from primary care and away from rural, underserved areas. So bringing primary care docs, generalists, to our region fits the bill pretty well. Primary care docs to a vast rural, underserved region. So this term extensivist is a new term. When I went into medicine over 30 years ago, I wanted to become an internist because I wanted to take care of patients, have a long-term relationship with them, and care for them wherever they needed their care. Home, hospital, nursing home, office, whatever. Now we have hospitalists, we have ambulatory doctors. Everybody's, it seems like, is becoming defined by where they provide the care. And the extensivist model is sort of the reinvention of that traditional, the person that takes care of you wherever you are. This is just a picture that it depicts that non-traditional model. This is a fellow who we diagnosed in our hospital with some severe problems, and he could have stayed in Billings Clinic Hospital for a few weeks and gotten a lot of tests and spent his 58th wedding anniversary in the hospital, but he recognized that he wanted to be home. He would accept what would come. He just wanted to be comfortable and at home. So we set him up for home care at his home, and we went out to his home 40 miles away from here a few times and did a procedure to keep him comfortable at home. This is that extensivist model, the idea of, what 40 years ago or 80 years ago wasn't that big of a deal. That's where doctors went. They went to people's homes and took care of them. How can we bring some of that back in a manner that's respectful of resources? That's what we're up to. So that's what I see primary care as being about. It's important because it helps people feel cared for. It simplifies their interaction with the healthcare system. It's actually safer, more efficient, and better outcomes. And that's what we've set about trying to provide for the community.
Dr. Bush shared with us the primary care model. And what we can do when we see our primary care physician is that primary care physician is going to discuss with you ways you can prevent maybe your certain chronic diseases or so forth. So going in and getting that annual exam. And so I think about that in terms of why I became a registered dietitian. I first was in business school, and when I was trying to calculate the cost of goods sold, I thought maybe that was my first sign. But I struggled with being overweight. I have a family that's overweight. I have breast cancer, a mother who's had breast cancer, probably because she was obese in her 20s, 30s, and 40s. I have diabetes. I have heart disease. So that's one thing I know. We cannot change our family or our genetics, and we can't change if we're male or a female, and we can't change our age. But there's two things we can change that we're going to talk about in the next 20 minutes, and Joey's going to do, is we can choose how we eat and how active we are. And there's lots of evidence about following a healthy lifestyle in terms of healthy eating and being active in reducing your risk of becoming overweight or developing diabetes, type 2 diabetes, heart disease, stroke. There's certain types of cancer. So we're going to talk a little bit about prevention, and I'm going to talk about what a healthy diet really is. And so when we think of nutrition, nutrition's still a fairly young science. When nutrition science discovery and recommendations, they focused around essential nutrients and the prevention of that. So like vitamin C and scurvy, vitamin D and scurvy, and vitamin C, beriberi. Now we're looking at nutrition science and the discovery and recommendations in prevention of certain chronic diseases, such as diabetes, certain types of cancer. So the shift has really changed in how we focus on healthy eating and nutrition. It's not so much about nutrient deficiencies anymore. It's about eating a healthy diet for life to prevent certain diseases. And so there's evidence that shows that we can prevent several 100,000 deaths a year by following evidence-based healthy eating guidelines. And the key is evidence-based. There are a lot of nutrition recommendations out there, or nutrition advice, but that's not necessarily scientifically evidence-based. And that's what I'm going to talk to you about in the next few minutes, is healthy eating is not extreme eating. It's not about omitting one certain nutrient or one food group. It's not low carb or no carb. Low carb diet is not a no carb diet. It's not extreme eating. It's just really healthy eating in a variety of ways with balance and moderation. And so what we can make a difference in our daily food choices. So I'm going to show you or talk to you a little bit about some of my principles and what I coach our patients to do in a healthy diet. the first and most important thing is about energy balance. And that's the calories you take in terms of food and drink, and the calories that you expend through physical activity, and then also your basal metabolic rate, the rate of energy, or the calories that you expend just breathing and eating and sitting and sleeping. So it's really, first and foremost, healthy eating should be about energy balance. So if you eat less calories and burn more calories, you're going to lose weight, right? So you have a negative energy balance. If you eat more than you expend, what happens? We have a positive energy balance, so we're going to gain weight. So if our energy in equals our energy out, we'll maintain our weight, right? In theory. So sometimes the best thing to do is, if you are on a track of weight gain, the first thing you want to do is stop the weight gain. Maybe not focusing on weight loss, but you're going to stop the weight gain by looking at where are my excessive calories coming from, or how many more calories do I need to burn. And I really say this because my first husband had type 1 diabetes, and oh man, he did not eat healthy. But now my second husband, he's a breath of fresh air. We enjoy healthy eating. We enjoy being active together. And so he'll say, well, this is healthy for me. And I'll say, well, Tim, it's healthy for you, but you don't have to eat 3 plates of it, right? So that's what happens, is when we think of foods as healthy, then the whole portion control goes out the window because it's healthy for me. So take almonds. How many of you eat almonds? A lot, right? Because we know they're healthy. They're a great source of fiber. They're high in vitamin E. They're nutrient dense in terms of minerals. They're a healthy fat. But what else are they? High in calories. But they're almonds. And so a handful of almonds. So that's my really big message to you here. Even though you're choosing healthy foods have calories. And the first thing that we want to do is think of our energy balance, because our weight affects our health, whether it's for our joints or our blood pressure or our risk of heart disease or diabetes. The first thing is working towards a healthy weight. And remember, a healthy weight is not an ideal weight. The research has shown that just losing 5 to 10% of your weight improves your blood pressure, your blood glucose, your lipids, all of that. So that's a healthier weight. So we have to also have a good definition of a weight is. So then the big thing about energy balance is really portion control, watching how much we eat. So we need to know the difference between portion versus serving. A serving size is the recommended amount. So like on the label, it will say the serving size. That's the recommended amount of that food. Or when you're looking at the My Plate and it says to choose 2 to 4 fruits per day, and a serving of fruit is a small apple about the size of a tennis ball. That's a serving size. A portion size is the amount you choose to eat, or the amount the restaurant chooses to give you. And so what has happened over the years is we have come to what's known as portion distortion. I mean, I remember that you used to buy bagels in the freezer section, and they were Lenders, and they were 3 inches in diameter, right? And now where do you buy bagels? At a bagel specialty store. Yep. And they're now 6-inch in diameter. So we've gone from 140 calories to 350 calories, but you still in your mind say, well, it's a bagel. But a bagel's not a bagel. Our portions have just gotten a lot bigger, haven't they? So we look at a cheeseburger, 330 and now 590. This is about 20 years ago when we were looking at portions. Sodas used to be about 6.5 ounces, and then more commonly it got to 12 ounces with the can. And now it's hard to find a can of soda, isn't it? They're all 20-ounce bottles. And so we went from 85 to 250 calories. French fries, 2.4 ounces, now to 6.9, and the calories have doubled. So portions are what you are being served or what you're choosing. And that's what's happened, is our portions have just gotten bigger, as well as our plate size. I grew up with the Corellware. Many of you probably grew up with Corellware. You know, their gold little flowers around there, and they were indestructible. I grew up with 4 brothers and a sister, and 6 of us doing dishes were a lot of fighting. But they were like 9 inches in diameter, right? Now, I measured my dinnerware at home, the stoneware that you buy, at Pier 1 or World Market or whatever. My dinner plate is 12 inches in diameter. So, and most dinner plates are. So when you buy a set of dinnerware, you get a dinner plate, a salad plate in that bowl, right? So really that salad plate is what we should be eating off of to follow the My Plate method. So we want to eat out of smaller plates, drink out of smaller mugs and glasses, you know, out of bowls. I have 3 different sizes of bowls. And so when you're saying to yourself, well, I had a bowl of cereal, well, you could have a bowl that really does only contain 1.5 cups. And then you've seen those big pasta bowls that come with dinner sets, right? So a bowl is not a bowl. So when we look at the plate method, choose a plate that's 9 inches in diameter. 50% of that plate should be coming from your vegetables. You know, the broccoli, the cauliflower, the green beans, the zucchini, the tomatoes, the bean sprouts, all of that. It should be a rainbow of colors. And that's the thing, healthy eating should be fun and flavorful, and it can be. But I know that healthy eating takes a little more work and a little more planning, because we're in an environment that the healthiest choice is the hardest choice to make. And that's what you have to change your environment so that the healthiest choice is the easiest choice to make. So back to the plate method, 50% veggies, and then the other half of the plate is divided into 2 quarter sections. So 25% protein, so choosing lean meat, fish, chicken, turkey, tuna, tofu, whatever your meat source is, your protein. And it could be beans and lentils. And then the other half is the grains. And so you can really use this plate method no matter where you go, whether you're eating at your brother's house, or you're at a restaurant, or eating at your own house. Visualize the plate, and it will help you bring your portions together, as well as making the right food choices, what we'll move on to now. So yeah.
Back on your last one where it had your grains, you actually had corn listed down there. Is that because of the...
It's a starchy vegetable.
Okay.
Mm-hmm. Oh, she asked that corn was listed as part of the grain on the plate method, and because that's a starchier vegetable. So I like, this is my favorite plate method. When you go to myplate.gov, it would have corn and the veggies. But I prefer you to eat more of the non-starchy vegetables and choose the corn and the peas and potatoes more as that starch. Thank you. Great question. So my first tip, besides energy balance, was the first. The second is focus on fiber. And so fiber is, many of us don't get enough. Many of us maybe only get 10 grams a day. But fiber is a great carbohydrate. It's non-digestible. It can help you feel full, so you eat less, so you can help you with your weight management. It helps lower your lipids, especially your triglycerides. It can help lower your cholesterol. It can help with bowel regularity. So choosing more fiber can help you live a healthier life, helps you maintain your weight, your lipids, and so forth, and bowel regularity. Lots of benefits. So what we want to aim for is 20 to 35 grams of fiber per day. That's an excellent. Metamucil, is it a good source of fiber? Yes, it is. So choosing fiber foods from your diet, you could choose whole grains. You've heard of that you want to make at least half of your grain servings whole grain. So that's barley, quinoa, wheat berries, whole wheat pasta, brown white rice, bulgur. So bulgur is cracked wheat, so you can make tabbouleh. So some of these you could serve warm, or you could make them as a salad. You can make barley vegetable soup. Wheat berries, like if you stop at the Wheat Montana, you know, it's a great halfway point to Missoula. You don't stop there to have a cinnamon roll and coffee, but stop there to purchase they have a chicken wheat berry chili mix that's phenomenal. So you could choose, it's a lean meat and a great source of fiber. So whole fruits and vegetables are an excellent source of fiber. So choosing whole fruit instead of juice. I'm a kind of a juice Nazi. In my world, what we use juice for is to treat a low blood sugar. Other than that, it doesn't have much use. You need to choose whole fruit. It has more water in it, more fiber, more nutrients, and the best of all is you're chewing it, so you think you're eating something. Many of us underestimate the calories we take in through our drink. So choosing whole fruits and vegetables. You know, at this time of the year where we live in Montana, we don't have a lot of fresh tasting vegetables available to us, a little more expensive, so don't forget about your frozen food aisle. I always keep frozen chopped spinach in my freezer, as well as like frozen broccoli and cauliflower mix, because you can add those things quickly, and it doesn't go to waste in my crisper drawer, right? And I use frozen berries when berries in the season are not very tasty or too expensive. So don't forget about the frozen fruit section. And the other thing to add, that can add, it's a lean source of protein, it's a protein source as well as fiber, is don't forget about beans and lentils. So a cup or half a cup of black beans or half a cup of lentils has like 8 grams of fiber. So the thing with fiber, we want to slowly increase it. Make sure you drink plenty of water and be active. Because if you rapidly increase it, your people you live with might not like you, and you might have a little discomfort too, right? So beans and lentils. Think of beans and lentils as a side dish, as a soup, stew, making in the morning maybe a scrambled egg and black bean breakfast burrito. Lots of different ways you can incorporate that. And I think the thing about healthy eating is sometimes it requires us to shop differently, prepare our foods differently, and not be afraid to try new foods. So one thing I always try to do is try a new recipe a week. And some of my favorites, well, this is a good cookbook, but what I like to use at home is like Cooking Light or Eating Well. I use Vegetarian Times, and a lot of times I'm always just on the web looking at recipes. So in order to become eating healthy, you have to try new things, right? And so sometimes we think we hate fruits and vegetables, but maybe that was when we were 8 and our parents made us eat them all. And the texture, and your mom used to cook the peas till they were pale green, yellow, or green, And so we have bad memories, or from our school lunch program. So now, remember, we're a little older. Maybe our taste buds are a little more mature, so trying new fruits and vegetables. The other thing, I'm hurrying. Sorry, Ju. So the other thing is sugar. So we really need to limit our added sugar. The American Heart Association recommends no more than 6 teaspoons of added sugar per day for females and no more than 9 for men. So what is added sugar? Added sugar is sugar that's added in your food preparation or in the processing of that. So most of us eat over 23 teaspoons of sugar per day. So, and why we need to limit the sugar is sugar actually causes an inflammatory response. So it can actually increase our risk of heart disease. Obviously, it increases our risk of becoming overweight or obese. It increases your triglycerides. So sugar is abundant in our food source because why? We love it. We love fat, salt, and sugar, and the food industry knows it. It's called the bliss point. They create a food that has the right amount of fat, salt, and sugar, and you're happy. Your brains just lighten up like a ping pong or a pinball machine. And so you're going to buy that food again, right? So it's abundant in our food supply. So we need to be diligent in reading those labels. The problem is with food labels, it will say the sugars, but it does not differentiate between added and naturally occurring. Now the food label is being reformulated and revised and should be out in the next year. So what you need to do is read the list of ingredients and look for anything with an OSC ending is an indicator of sugar: dextrose, fructose, maltose, invert sugar, corn syrup solids, high fructose corn syrup, honey, molasses, nectar. If those are one of the first 2 ingredients, I would probably put the food back on the shelf or compare another brand, because some manufacturers are starting to use less sugar. Where sugars really can come into play is your condiments. Look at your barbecue sauce and ketchup. Lots of sugar in there, right? And our drinks and then our processed foods. So keep in mind, 4 grams of sugar is a teaspoon. The other thing we want to do is watch your fats, right? A high-fat diet is not going to help you lose weight. Fats are 9 calories per gram, carbohydrates and protein 4. We need to watch our fat. And right now we need to still limit our saturated fat. I know there's some literature out there being published that maybe saturated fat isn't as bad as we once thought, but still there's still not enough evidence to change the recommendations. So saturated fat raises your LDL and can lower your HDL. Maybe there's a difference between saturated fat coming from plant sources, such as coconut and palm kernel, versus animal sources. So I think the research is still going to come out on that, and we'll know a little bit more. But right now, the evidence shows us we still need to watch that. We want to avoid trans fats. We know that. That causes our LDL bad cholesterol to go up. It causes the good to go down. And so that's a lot in your processed foods, anything that's partially hydrogenated oil. And the thing is you want to choose more monounsaturated fats. So like avocado, olive oil, canola oil, peanut oil, those are all good sources of monos. Those actually can... Doesn't that look good? I know. That's kind of mean of me, isn't it? To put it up during here. Yeah. Yeah. So the other tip is limit your sodium. What's recommended is about 2,300 milligrams of sodium per day. Some of us may need around 1,500 per day. Just depends on your age and also your comorbidities. So most sodium comes from processed foods. It's not what we cook with or what we put at the table. That's about 7% of our sodium intake. It's mostly from the foods we purchase at the grocery store. So again, read those labels. But it's still a good idea to omit it in cooking and at the table. You can help reduce it there. And then think of using seasoning powders versus salts or Mrs. Dash. Two of my favorite Mrs. Dash is the Fiesta Lime and the Chipotle something. And they're great. And they have a slew of flavors now. So good choices. And the last thing I want to talk about is I talked about what you should eat, how much you eat, and now let's briefly talk about how you should eat. And what we really need to be is mindful. This is the how you eat. I'll tell on myself one day, my husband loves Twizzler licorice, and I was stressed out, and so I grabbed a handful, and I marked myself downstairs, and I plopped myself in front of the TV, and I put my handful on my lap, and I'm just munching away, probably because I'm mad. And the next thing I know, it's gone. But I'm like, and I accused my husband of stealing my licorice, right? But because I wasn't mindful. I was distracted, and I was, eating in front of the TV. And if we're not mindful, that can lead to overeating. So what we don't want to do is multitask while we're eating. The best thing, I think, with everything is when we ate as a family and we started our meal with some sort of blessing of grace, right? Because what that does is we're taking that deep breath, we're focused on the food, we're looking at it, and it's all putting us in that moment of eating. Now we're eating in front of the TV and the computer, or while we're working or on the road, and we're not aware of how much we're eating or what we're eating. So slow down, savor the flavor, enjoy the food. The other thing is maybe check how full am I halfway through that meal. On a scale of 1 to 10, and 10 being where you have to undo your top button, and 1 you're still just your stomach's growling. You want to be comfortable at 6 or 7, but you don't want to be stuffed. So be aware of your hunger and your fullness. Don't let yourself get too hungry. The other last tip is just set your environment up for success. So many people tell me why I don't like to cook, but come to find out their counters are full of books and their computer, or you don't have counter space, so it's overwhelming to cook. So maybe one of your first things is to clean up your kitchen, make it more appealing to go in there to cook. Try to maybe put some of the appliances in the cupboard. Set yourself up for some success. Organize your kitchen. The other tip is maybe those foods that are more tempting, put those way in the back so you don't see them when you open the cupboard. So I tried this on myself. Peanut M&Ms are my favorite candy, and we had some. And so I stuck them, my cupboards are really tall, so I usually have to get out a stool. So I had my husband put them way in the back, right? Well, I couldn't see it when I opened it, and then it was more effort to get to them. I just said, it's not worth it, and I forgot really that they were there. So sometimes that out of sight, out of mind can help you when there's those tempting foods. So just remember that healthy eating is really kind of basic eating. It does not have to be extreme. I gave you a lot of tips in a short period of time, and maybe it's just about focusing on one thing that would make the best difference for you. And you have to keep in mind is how we eat is individualized. Because it works for someone does not necessarily mean it's going to work for you. It should be your way of eating that helps you meet your weight goals, your blood pressure goals, your glucose goals, and your healthy living goals. Something that you can afford and you can do forever. You don't want to eat healthfully for one day. You might feel better for that one day, but it's not going to help you with the prevention that you might be aiming for. So just start with something small, and it can make a big difference.
All right, thank you guys. What a treat to be here. My name's Joey, and I've been here a lot, probably way too long. Everybody's kind of tired of hearing me, which is cool, because sometimes I get tired of hearing me. 15 years of marriage to the same woman, she's definitely tired of hearing me. How many of you get the paper? You read the paper regularly? Good, perfect. How many of you are Patriot fans? No, just kidding. How many of you saw this article come out today? Too much sitting is worse than being obese. What have we been doing all day? Since you got here. I know, camera person, be careful. It's going to get crazy. Can't keep up with me. So we got here and we sat, didn't we? Have you guys seen this article? Oh, here's the advertisement. Thank you, advertisement people. Do we have a speaker? I don't know where the speaker hole is. I got you covered. Oh, you're the man. Thanks, Big Mike.
Risk.
Our
Here, let me
study
rewind that.
showed that sitting
Sorry,
time
buddy. I forgot.
was associated with a higher risk of all-cause mortality, heart disease mortality, cancer mortality, and diabetes, independent of exercise.
Still, some exercise is better than none. Researchers found that while prolonged sedentary time was harmful for everybody, the risks were less pronounced in persons who participated in higher levels of physical activity. I don't get too smug.
Just because we exercise a half an hour a day does not mean we can sit for the other 23 hours a day.
More than half of the average person's waking hours are spent sitting. Study authors say that promoting health messages about reducing sedentary time are as important as promoting physical activity.
There are simple things we can do. Every half an hour we can stand up for 2 to 3 minutes at a time. Big add up over the course of the day. Watching TV, stand up in commercials. Maybe take 15 minutes of an hour show and stand.
Dr. Alter advises his patients to start slowly, try to reduce sitting times by 15 to 20 minutes a day, and increase that week to week. Ultimately, he says, you should aim for 2 to 3 fewer sedentary hours every day.
Aha! What do you think about that? Any questions, comments? I'm pretty much done. So here's the deal, right? I mean, that's the truth. Sitting is the new smoking. So imagine if I came here to tell you about the problems of smoking, and while I'm telling you, I'm smoking a cigarette. You know, you guys got to stop that smoking. It's going to kill you. Because that's what we've done today. We've sat while we're talking about health and wellness, and I just showed you proof beyond a shadow of a doubt that sitting is dangerous to your health. Yes?
So why didn't you stop us at about 20 hours?
Right. So the question is, why didn't you stop us at 20 minutes? Well, because Dr. Bush wouldn't quit talking. And Lisa just kept on blah, blah, blah. Healthy eating, whatever. No, I'm just kidding. We have to sit sometimes. I don't know if there's necessarily a correlation between your butt being in a seat and your learning curve, but we sure act like it. You've got to be sitting if you want to get anything done at the computer or in a lecture format. I don't agree with that. A lot of times when I come to speak to groups, I tell them, get up, and move around during my talk. It's not disrespectful. It just means that you are adhering to these guidelines. So what did they say? They said you know what? People talk about the piece of equipment you need. The only equipment you need is your watch. You just need a watch. Every hour, what do you say? Get up for how many minutes? 2 to 3 minutes. How many times do we look down? You've already been sitting for an hour. I mean, like that it goes by. You watch a movie, how long is a movie? 2 hours. And sometimes you watch a TV show, or 2 or 3, and then we go sit, and then we get in the car and then we sit down and we eat and we sit, and then we go to church and unless you're Pentecostal. All right, hallelujah. Okay, so here's the deal. We are going to stand. Are you ready? You got to do it. Come on, stand up. There we go. Okay. There you go. That includes you guys. One's watching on TV. Yeah. On the telemedicine, you got to get up where you're at. Just move. It doesn't matter what you do.